PKC Institute of Pharmacy is reputed institute at university and state level with world-class infrastructure and well-qualified staff. So for 360-degree education, visit MET.
Met.
As sharp as you can get.
Hello students, come and experience the happiness at Maytech Institute of Pharmacy and enjoy your college life at MedPKC campus. Thank you.
A very good morning to everyone. I, Suchita Shirsat, welcome you all to second day's first session of National Level e-FDP program, Implementing Education Regulation 2020 Challenges and Opportunities, organized by METS Institute of Pharmacy in association with APTI Maharashtra State. Yesterday, we have three eminent speakers who delivered lectures on some important topics. Dr. Manjari Gharat talked on patient counseling and community pharmacy and management. Dr. Rakesh Somani delivered very informative session on CO-PO mapping and attainment. And Dr. Anubha Khare spoke on objectives and role of assignments. Now we are moving ahead with second day of our e-FDP. The speakers for the first session, Dr. Shraddha Prakash Devarshi, Gold Medalist, Assistant Professor at Indira College of Pharmacy, Pune. Dr. Devarshi pursued her Doctor of Pharmacy from Pune College of Pharmacy, Pune, and did her internship in Bharti Hospital and Research Center, Pune, where she was posted as a clinical pharmacist in various hospital departments. Dr. Devarshi won first prize in Braura 2015 of Pharma Tech event poster presentation and attended various conferences and seminars. Madam has published various research and review articles in national and international journals. We are extremely honored to have Madam's presence. She will be enlightening us on topic pharmacotherapeutics through SOAP. Respected Madam, now you may please start with the session for today. The screen is yours, ma'am. Thank you.
Thank you. Sir, you're able to see the screen?
Yes, ma'am.
Thank you. First of all, I would like to thank you, ma'am, for the kind words, what like for the introduction, what she has given to me. So I'm Dr. Shraddha Prakash Devarshi, and today I'll be taking you through the presentation that is pharmacotherapeutics through SOAP writing. So basically, SOAP is nothing but an acronym that stands for S subjective, O objective, A assessment, and P is plan. Ma'am, I'm audible, right?
Yes, ma'am. Yes, ma'am. You're
Yes, ma'am.
audible.
Okay. So basically, SOAP is an acronym that stands for S, that is subjective, O objective, A assessment, and P as plan. So in the further slides, what we'll be doing, we'll be trying to understand that exactly what we have to write under this each of these headings, what information we have to gather from the patient, so that the students can effectively gather the information and deliver the best information or best treatment to the patients. So basically, subject is nothing but the information that you are gathering from the subject. Now the subject is nothing but your patient. So whatever information your patient is going to tell you, that all you are going to capture under this heading, that is subjective. So this is nothing but all the information provided by the patient, and you have to gather that through the interview you are going to take from the patient. Now under this also you can divide this heading into different subheadings. Like you can ask the patient for their chief complaints. Chief complaints is nothing but why did the patient come into the hospital, what are the basic complaints the patient is having, and why did they get admitted. That is nothing but chief complaints. Then we have the history of presenting illness. About this point I will talk little later in the next slide. Okay, then we have to gather information about their past medical or medication history. Medical history is nothing but ki have they undergone any surgery, or are they having any other comorbid conditions. Like for example, from how many years they are having hypertension, from how many years they are having diabetes mellitus. Because we know that these diseases can have a association with each other, and also the selection of drugs are going to change accordingly. Okay. Then about the medication history also, for this each of this disease they must be taking some medication, so we have to gather that information also. Next, under the same we are having the social history. Social history means ki is the patient having any drinking habits, is the patient smoker, or what type of occupation the patient is doing, is the patient involved in any kind of physical activity. These all information you are going to gather under the heading subheading social history. Next is family history also. Ki, for example, many of the non-communicable diseases like diabetes, hypertension, we know that they are going to be passed on from one generation to next generation. So we need to know ki what is the family history, so that we can understand ki what is the association of that disease with the family. Like are the parents having, then we can understand yes the child is also having the same disease. So basically, once again, I'm telling you, subjective is nothing but information that you are going to get from your subject. Now, this information, like the chief complaints, can be in a very layman language, because understand the patients are not going to be like using any medical terminologies. So they will tell you simple terms like I'm having stomach pain or I'm having vomiting. So they are going to tell in very layman language, common language. No medical terminologies are going to be used by the patient. Now about the history of presenting illness, for that you can use a one more acronym, that is old cards, and this stands for, that is onset. So this old cards is going to help you to capture the chief complaints very effectively. Like for example, onset, when did the chief complaint start in the patient, then where is the chief complaint basically located, and then from how long the chief complaints the patient is suffering from. That is onset, location, duration. Okay. Next, we are having characterizations. So the patient will be giving different like characters to these chief complaints. Like for example, if the patient is having chest pain, so they will be describing it as I'm having burning sensation in my chest, or maybe they will be telling I'm experiencing heaviness in my chest, I'm not able to breathe properly. So these all characteristics they are going to tell, which are going to be associated with the chief complaints. So we'll be able to understand what the patient is trying to say. Next is alleviating or aggravating factors. Means ki anything which is going to make the chief complaints better, or it is going to make it worse. Triggering factors. So these are, or any triggering factors or any other factor which is going to help the chief complaints to be better. Okay. Then is radiation. So is the chief complaints in having, like it is restricted to one location, or maybe it is going to be radiating. Like for example, the pain in angina. So most of the time the chest pain is going to be radiating to the left side of the body, and also the left side of the face, also the jaw line and everything. So that is nothing but characteristics, elevating and aggravating factor, and radiation. Next is temporal factor. Temporal factor means ki is the chief complaint getting better or worse with the time of the day. Maybe the patient is going to experience the chief complaints in the morning time only. Like for example, the knee pain that is associated with osteoarthritis or rheumatoid arthritis. Mostly the pain is faced or it is worse during the daytime, and it becomes better with the time of the day. Okay, that is temporal factors. Next is severity. So you have to ask the patient to rate their own chief complaints, so that we can understand whether the chief complaint is tolerable or it is intolerable. So we can understand more whether the patient is able to take up that chief complaint or it is becoming intolerable and we have to give the management very quickly. Okay, so this is nothing but all cards. This is going to help you to capture the history of presenting illness more effectively. Okay, again, once again, this history of presenting illness, we are still in the subjective part only. Okay, subjective is nothing but information that you are going to gather from your subject, that is your patient. Okay, next, now moving to the next part, that is objective data. Now this objective data is nothing but all the information that you are going to get from different lab parameters, because after the patient tells you okay, what complaints you are going to have, the physician will be accordingly taking different type of samples or will be suggesting different lab tests. So whatever information you are going to get from this lab work, you are going to interpret from the different lab investigation, is nothing but your objective data. Okay, so in that we can have vital signs like blood pressure, heart rate, body temperature, respiratory rate. These are vital signs. Then is physical examination, physical examinations of all the systems that are there, all the important systems of your body: cardiovascular system, respiratory system. Then we have the gastrointestinal tract. These all systems are going to be checked by the physician and they are going to write some observations. Okay, then we are going to have different lab values. Biochemistry values are there. Then we are going to have hematological, lipid profile tests are going to be there. And lastly, some diagnostic test. In that, ECG is going to be there, spirometry. So whatever relevant diagnostic tests are going to be there, that information is whatever you're going to gather from all these things are called as objective data. Also, we have to remember one thing, that we have to not get mixed up with symptoms and signs. Okay, signs and symptoms are like not one and the same thing. Symptom is nothing but which is told by your patient and it is mostly patient's subjective description, while sign is what, it is an objective finding and it is related to your symptom which is told by the patient. Like for example, the patient will be describing abdominal pain, so it is a symptom, while sign is what, abdominal tenderness, that is going to be done by the physician. So symptom is nothing but told by your patient and sign is nothing but it is related to the symptom and it is mostly an observation of the physician. Okay, so subjective data is nothing but which is related to your subject, you are gathering from your patient. Objective is nothing but what you are going to get from the lab investigation, different diagnostic tests. Okay, now you have got the subjective data, you have got the objective data. Moving to the assessment part. Now this assessment part is the very important part, because subjective we are getting from patient, objective we are getting from the lab investigation. So we are not, so far we have not done any interpretation. Now in the assessment part, what we are going to do, we are trying to get this subjective information and the objective information together, and then we are going to take help of some standard treatment guidelines or some evidence based medicine, and then we are going to come to one conclusion, that is the final diagnosis in your patient. What exactly your patient is having, what problem the patient is facing, that is nothing but your assessment part. In this you have to correlate the subjective data to objective data. Like whatever symptom your patient has told you, you have to correlate that with the proper lab investigation. Like for example, if the patient is having diabetes mellitus, so he will be telling you different sorts of symptoms, like for example polyuria, polydipsia, he's feeling too much of hunger, like he's feeling hungry all the times. While in the objective data you will find different type of lab investigation, HbA1c, fasting blood sugar levels, then postprandial blood sugar levels. So you're going to like gather this, clump together this subjective information and objective information, and then you will come down to one conclusion, that is your patient is having either type 1 or type 2 diabetes mellitus. So this is nothing but assessment. Now in this also you have to remember that you are going to start with the problem list. Problem list is ki what all things you have to manage in the patient, and you have to prioritize this problem list. Like the first problem will be the one which is going to be your highest priority one. Like for example, if you are having high blood pressure on one side and if you are having cold and cough on other side, so it is the high blood pressure that requires emergency treatment instead of your cold and cough. So you're going to write high BP on the first number, and then you will list down the cold and cough. Okay, after that you are going to assess each of the problem ki what can be the reasons in this patient. Are there is this drug related problem? What are the factors due to which the patient has got this problem? So you are going to discuss each of the problem in detail. Okay, so assessment is now what? Getting your subjective data with your objective data and coming down to one conclusion. This is your final diagnosis in the patient, that is assessment. Okay, next last part is what? The plan part. Now this plan is what? Now we have understood that what the patient is facing, what problems the patient is having. Now the next thing is to provide a treatment for each of the problem. So that comes into your plan part. So you are going to suggest one treatment to this patient for each of the problem which they are going to have. Okay, now in this also you are going to first start with goals of therapy, because when you are going to treat your patient you will have some goal in your mind. For example, if you are giving treatment for diabetes, so you have to bring down the fasting blood sugar levels to this levels, this much mgs per deciliter. Or maybe you want to bring down the postprandial blood sugar levels to this much mgs per deciliter. So that will be your goals of therapy. Then are going to be different treatment options. Whatever patient is having, whatever problems they are having, whatever symptoms they have told you, for that you have to provide them appropriate treatment, keeping in mind all the different aspects of the patient. What comorbid conditions they are having, whether they are having any side effects to the drugs, or what are they facing any allergies, keeping in mind all the aspects of the patient. Then we are going to also write drug related problems under this. Like for example, drug interactions are going to be there, or maybe the patient is having some common side effect to one of the drug. So you're going to write the drug related problems also under plan part only. And then lastly we are going to have patient counseling. About patient counseling also, towards the end I will be like putting more focus ki how we can take this patient counseling for the students also. So let me summarize this first part. So S is what? Subjective, the information that is provided by your subject. Objective is all the information that you're going to gather from the different lab parameters, diagnostic test. A is nothing but getting together your subjective and objective data, try to correlate that and come down to one final diagnosis. Okay, and plan is nothing but providing treatment to each of this problem. Okay, and the counseling part. So this is nothing but SOAP. Now in the next slide, I would like to discuss the SOAP writing with one of the examples, so that it will become more clear ki exactly under each of these headings what information you are going to write. Okay. So here we are having one patient, KG, who is 62-year-old male patient and who was admitted on the complaints of having cold and cough. So this cold and cough is nothing but the chief complaints with which the patient got hospitalized. Now see the history of presenting illness, what the patient is telling you, that he is not satisfied on being placed on a low sodium diet, and then he is reporting that he is having cough and shortness of breath, particularly when he walks certain amount of distance. So you can just remember the old Katsky, what all information about history of presenting illness you have to gather, even though all the information is not here captured correctly, but then also remember that old cards we are having onset, then we are having the location, from how many duration we are having. So we have gathered that information in the history of presenting illness. Then now see the medical history of the patient. Now in this medical history, what the patient is having, he's having HTN, he's having diabetes, COPD and CKD. So the patient is having 4 comorbid conditions. Now also medications for each of these diseases is already on some of the medications, but I would like to I would like you all to pay attention on the 2 medications which I've highlighted, that is triamterene and hydrochlorothiazide for hypertension, and next is pseudoephedrine and guanfacine capsule he is taking for cold and cough. Okay, next is the social history. Now your patient who is hypertensive, has COPD. So what type of social history the patient is having? He's a smoker. He's also having alcohol drinking also. Then he's not very happy, like in the history of presenting illness we have understood he's not very happy with the low sodium diet which was suggested by the physician for managing HTN. Okay, then he does not restrict his diet in any kind of way, so everything and anything he's having. He does not exercise regularly also, so you can imagine ki a patient who is having like COPD, HTN, CKD and is not exercising, not dieting, what condition the patient is going to have. And also this COPD condition is there, it is somewhat limiting the physical activity of the patient, because in the subjective data we have seen the moment the patient walks a certain amount of distance, the patient starts feeling shortness of breath or is breathless. Okay, also the patient is retired and is not living, like it lives alone, so he's not any like a working type of patient, he's a like he's a type of patient who is mostly at home. And family history also you can see both mother and father had a like history of cardiovascular disease, and mother also had diabetes mellitus, so we are able to associate ki what is the background of this patient. Okay, 62-year-old male patient, cold and cough, like feeling breathless on walking certain amount of distance, has multiple disease states. Okay, so this is all the subjective data what we have got from the patient, from your subject. Next is your objective data. Objective data, like I told, once again I'm repeating, it is nothing but the data you are going to get from vital signs, lab investigation and diagnostic test. Okay, so these all are going to be suggested by the physician which are relevant to your condition. From the signs and symptom, the physician will have an idea ki what is the problem, and then the physician will be suggesting some of the diagnostic test. Now see here, don't look have an attention of at all the lab values, only the one which are highlighted are the ones which are very relevant ones. Like for example, you can see the BMI of the patient is 26.8, it is like more than normal. Also you can see the patient is not doing any kind of physical activity, not dieting. Okay, is retired, so he's not doing any kind of occupation also. Also you can see the blood pressure of the patient, it is 168 by 92, and also when it is repeated when the patient was sitting, it is also very high, 170 by 90. So the blood pressure is increased, even though in the subjective data you know that the patient had a history of HTN, is taking combination of two antihypertensive medication, then also the blood pressure is on the higher side. Okay, next you can see in the next observation, in the eye you can see certain abnormal observation. Okay, mild atrial narrowing is there and arteriovenous nicking is there, so this is an abnormal observation in the eye which is there. In the respiratory system you can see the patient is having expiratory wheezing, like as the patient is of COPD, so that is why the patient is having the wheezing complaints. Okay, so in the objective data the one which is relevant is what, BMI, then we are having the blood pressure which is higher. Okay, and in the eye we are having the narrowing and nicking, and respiratory system wheezing sound is there. Now in the lab investigation also the lipid profiles were done. Okay, so lipid profiles also you can see the LDL is on the higher side, triglyceride is also on the higher side, and HDL is decreased, which should be actually above 35. Okay, in the special diagnostic test you see ECG is normal, echocardiogram we can see the ejection fraction of the patient is less. Spirometry, which is a test for COPD which was done 6 months ago, it is also like abnormal because the patient is having COPD. So now from this objective data what you have understood, high blood pressure the patient is having, abnormal observation into the eye physical examination, and also for COPD the patient is experiencing wheezing. Now in the assessment part you see, assessment part what is there, ki you have to correlate the subjective and the objective data and then come down to the problem list and prioritize your problem list. High priority problem you are going to place at the first number. Like for example, our first problem is going to be uncontrolled HTN. Because why we are writing uncontrolled? Because the patient is already on combination of antihypertensive medication and it is still very high. Okay. Now there are some reasons for this uncontrolled hypertension. First of all, the low sodium diet, which for which the patient is not adhering to. He is not very happy. He is not complying with the low sodium diet. Next reason can be the choice of antihypertensive medication, that is triamterene, which is a sodium sparing diuretic, and other is thiazide diuretic. So maybe that choice is not right. And other is the OTC medication. For a cold and cough, the patient is taking so like ephedrine and the guanfacine preparation for cold and cough. So that may be also increasing the blood pressure of the patient. Okay, then we have the next problem, that is there decrease ejection fraction, and lastly cold and cough. So here understand, prioritize your problem list. Hmm? Now in the next slide also I have given the discussion of the very first point, that is our uncontrolled HTN that the patient is having. So like how you are going to discuss this problem in detail. Ki the patient's blood pressure reading, that is 168 by 92, on seating it is 170 by 90. So these blood pressure readings are not meeting the JNC 8 guideline goals. JNC 8 is nothing but an international hypertension guideline. So they have given the BP goal that should be less than 140 by 90 mmHg. So that is not meeting. Even though the patient is being placed on combination of antihypertensive medication, given the max dose, then also the blood pressure is elevated. So what can be the reasons that you have to write here? You are trying to dig deep into this problem. That is nothing but your assessment part. So, what can be the factors that are contributing to this increased BP? First of all, the OTC medication the patient is having for cold and cough, the ephedrine is taking, and the guanfacine. Again, is non-compliance to the low sodium diet. So he's not restricting his diet in any way. Also, not like very happy with the low sodium diet. So these all factors are just increasing the BP. Okay, next in the assessment part, more discussion is needed. Like for example, here you see age, the male gender of the patient, family history, like the mother, father both had HTN. So these are nothing but non-modifiable risk factors for HTN, for which we can't do anything. We can't change the age of the patient. So these are all non-modifiable risk factors. While social history, that is drinking habits, smoking, obesity, right? The patient is having higher BP, not restricting the diet. Then diabetes mellitus. In the lipid profiles also you could see triglyceride was increased, HDL was decreased. Okay, and also lack of physical activity. These are all the modifiable risk factors for HTN. So you can suggest some lifestyle modification, or you can give some medications to the patient through which these modifiable risk factors can be modified or they can be managed. Also COPD which the patient is having, this is also limiting the physical ability of the patient. Because of that breathlessness, the patient is not doing any kind of physical activity only, and because of less physical activity, again the patient is gaining weight. Also on the other hand, the patient is not dieting, not adhering to the low sodium diet. So it is just adding more fuel to your problem. Also the next problem which we had given, that is the reduced ejection fraction. Now this can be either due to the worsening COPD condition or because of the other comorbid condition like CKD the patient is having. Also the patient is having like diabetes mellitus also. So because of these comorbid conditions also the ejection fraction is reducing. So in this way, you have to write the assessment, write the problem list, then take one of the problem and try to understand why the patient is having the problem, what are the etiologies in the patient, what are the reasons the patient is having the problem. So this is assessment part. Now this line we have to write, correlating subjective and objective data, the final diagnosis in the patient is what? Hypertension stage 2 uncontrolled with diabetes mellitus, CKD and COPD. So gathering the subjective and objective data, we have come down to one final diagnosis, that is your HTN stage 2. so that in the plan part we will give the appropriate treatment. Okay, so planning is nothing but what? Giving proper treatment to your problem. Okay, so subjective is all the information which is given by your patient. Objective, we have seen lab parameters. Assessment is nothing but clumping the subjective and objective data. Okay, so in the plan we are having the goals of therapy. Okay, so our short term goal, the one which we want to immediately attend, that is nothing but controlling the blood pressure. It is 168 by 90, so you have to immediately normalize the blood pressure of the patient, otherwise the patient can have complications. Okay, so that is controlling the bp is your short term goals, while long term goals which are going to take months and years together to come are what? Prevention of any kind of complications due to the comorbid condition, minimizing any end organ damage. Already in the eye examination you can see the nicking and hemorrhage, so we have to minimize the end organ damage in the patient, and also prevent any cardiovascular mortality, because the patient is having CKD, hypertension and diabetes together, which is a lethal combination, so we have to bring down the cardiovascular mortality. So this is our goals of therapy, and for this we are going to plan the treatment part now. Now in the treatment you can see what treatment the patient is taking. Some of the drugs are already the ones which the patient is taking, like different types of bronchodilators are there which the patient is taking for COPD. The patient is taking insulin for diabetes mellitus, it is under control, so no problem. Okay, the I would like you all to pay attention to the last two medication, that is this amlodipine, lisinopril and atorvastatin. Now the patient was taking triamterene and hydrochlorothiazide, but then the patient's blood pressure was still on the higher side. That is why we are planning to change the combination to amlodipine and lisinopril. Okay, also why we are choosing this particular drug combination, that also we are going to get it clear in the next slide. Okay, and then we are having atorvastatin because you can see the lipid profiles are on the higher side. So now see this, why we are the patient is suggested with ACE and CCBs, because ACE are going to reduce the cardiovascular risk in the patient, and also is going to decrease the progression of diabetes, and also is going to bring down the blood pressure also. Again, ACE inhibitors are excellent choice of drugs in patients who are moving towards heart failure, because you know the patient's ejection fraction is decreasing. Okay, also when you're going to put the patient on this combination ramipril and amlodipine, you have to monitor some lab parameters. These also you have to write in the plan part. So what you are going to monitor: serum creatinines, then BUN, serum potassium, and also the blood pressure. So when you are going to put the patient on this drug, have a baseline reading, and then you can repeat after 1 month, and then you can less frequently you can monitor these lab parameters. Start the drugs with a very low dose and gradually increase the dose, so that you can understand the response of the patient also, and you don't want to bring down the blood pressure too quickly. That is why low dose, and also if needed then you're going to increase the dose. Common side effects of which the patient is going to have is nothing but dry cough due to ACE inhibitor and constipation due to CCBs. So the students about each of the drug under the plan part. Why we are giving this drug, then what are the lab parameters that you have to monitor, then what are the common side effects that we have to pay attention to. Here I've just provided one example for you all, that is ramipril and amlodipine. Now this is the standard treatment guideline, and from this standard treatment guideline you can see the patient is having diabetes, patient is having CKD. Okay, and below that they have given the choice of drug, and that is why we have said that ACE inhibitor and CCBs are the best choice, because why? The evidence is saying that this is the best choice of drug. So you have to take support of the guidelines, standard treatment guidelines, and then you have to suggest the drugs to the physician. You can't just on your own suggest a new drug to the patient. Okay, you have to have some evidence in your hand. So this is nothing but your JNC 8 guideline, which is meant for hypertension. Okay, then we are having in the plan part certain suggestions to your physician, Now we have suggested what? We have suggested atorvastatin for the hyperlipidemia, and we have suggested a new combination for hypertension, that is your amlodipine and ramipril, a ACE inhibitor and a CCB. So change in the choice of antihypertensives, okay. And other is what? Adding a antihyperlipidemic in the patient, because the patient is having multiple disease state in them. Also the age of the patient is more than 60. Family history is also very like positive. Social history is also like drinking and smoking. That is why it is better to start with a antihyperlipidemic drug, so that the cardiovascular mortality can be decreased. Okay. So in the assessment part, till now what we have seen, goals of the therapy we have seen, short term and long term goals, bringing down the blood pressure, that was our main goal. In the treatment we have suggested, instead of triamterene and hydrochlorothiazide, we have changed the choice to amlodipine and ramipril, and we have added atorvastatin. Okay. Now one more DRP in the plan part, what we have understood, that the phenylephrine and guanfacine which the patient is taking for cold and cough, that is actually elevating the blood pressure. So instead of that, what we can do, we can ask the patient, or we can suggest taking only guanfacine, which can manage the cold and cough very effectively. The phenylephrine is actually can contribute in increasing the blood pressure. That is why we are suggesting ki please change this combination to only guanfacine. Also in the plan part, you can suggest some of the more additional tests, like for example the spirometry which was being done 6 months ago. We need to have the most latest report, so that we can understand ki whether the COPD is in control, or whether the treatment is working or no. Next is what? The arterial blood gas and chest x-ray, same for your COPD conditions also. And for the cardiovascular drugs that are being suggested, the antihypertensives, we have to ask the patient to come for the follow-up after 1 month, so that we can understand whether the blood pressure is in control or no. So this is all in the plan part. Goals, treatment during the hospitalization, drug related problems are there. Okay. And lastly we are having the patient counseling that is given to the patient. Okay. Like for example, in the patient counseling there are three parts to your patient counseling. First is disease counseling. What disease the patient is having, about that you have to provide the counseling. Second is drug related counseling. Okay. And lastly lifestyle modification counseling, any diet changes, any exercises, these are all the lifestyle modifications. About patient counseling, I will be taking one more example, so that we can understand the steps of the patient counseling also, and how we can effectively teach this patient counseling to the students also. Okay. So patient in this, for your particular patient right now who is there, so what you are going to tell the patient, telling the patient about HTN, hypertension in simple language. So hypertension is what? It is persistent increased pressure on the walls of the blood pressure, on the blood vessels. As the patient is having multiple conditions, blood pressure control is very much important. That is why he has to stick to the drug regime that is being given to him. Whatever dose is there, timing is there, he has to take it properly, then only the blood pressure is going to be under control. Okay. Next is what? The patient, you are going to tell about the drugs, that is key. If the patient is going to experience any common side effect, like for example dry cough with ACE inhibitors, so they can consult the physician, so that we can manage, or we can change the choice of this antihypertensives. Next, you're going to suggest dash diet, and also you're going to ask the patient to reduce the salt intake. Now you know your patient is not very happy with the low sodium diet, so how you can include this change into the diet of the patient? You can ask the patient ki maybe in the diet you have whatever salt you are having, but extra salt what the patient is having, use of table salts, like putting salt on the salads, or maybe they are having consuming fried foods, or pickles are there. So these all food items contain high sodium level, so they have to cut down on the consumption of these food items. Okay. Also, this dash diet is specially for hypertensive patients, that is including fresh food, fruits, then vegetables in the diet, consuming less fatty diet, consuming less oily food. So this is nothing but dash diet. Then also next is what? Lifestyle modification. Your patient is obese, retired patient is not exercising, so you have to stress the importance of including some amount of exercise into the patient, like light walking they can do at first. Whenever they will reduce the weight, then they can do some kind of exercise. And lastly, changes in their social habits, that is stopping the smoking and also limiting the alcohol intake, because the patient is all smoking also, and smoking is going to worsen the COPD condition, also HT and diabetes, so they have to stop smoking and slowly decrease the alcohol intake also. So you can see the patient counseling should be like divided into three parts: disease, then drugs, and lifestyle modification. Okay. I would like to tell you more in detail about patient counseling, ki how effectively we can take this counseling part as a practical to your diploma students. So first we will start with the patient counseling steps. So there are four steps in this patient counseling. First step is preparation for the session. So like you are understanding, when you're giving patient counseling, even though you're telling this points in very easy language, we have to prepare for each counseling session very deeply, because any information that you're providing to the patient should be up to date, should not have any error into that, because there is no scope for error in any information you're giving to the patients, because they are going to follow your instructions very keenly. That is why preparing from the session is very important. So before the patient is going to come for the counseling session, you have to take up all the patient's file, the information what is there, and prepare on the drugs and the disease what the patient is having. Next is introduction or opening the session. So this session is nothing but building the base for your patient counseling, in which what you are going to do, you have to build a rapport with your patient, ask their name, ask their date of birth, or like what type of occupation they're doing, what kind of daily activities they are doing. Okay. Or you can even ask them ki what, like you can clear the purpose of the counseling, ki why they are here with you. Or you can also ask them any concern, any particular concern that they are having, any issue that they are facing in their health. So that what will happen, you can focus your counseling session into that particular direction only. Next is that explanation related to the disease and the medication. So this is going to be the body, the main part of your patient counseling: disease and medication counseling. Okay. And lastly, we are having closing the session. So with one example, we will just clear each of the step key, how we can do the counseling properly, and how your students are supposed to do the counseling, what type of language they have to use. These all we will see. Now I'm directly starting from the step 2 only, because step 1 is nothing but preparation for the session. So that we are not going to take up here. We are going to start from the step 2 directly. That is nothing but introduction or opening of the session. So in the opening, like what you have to do, you have to introduce yourself. You have to tell your name. You have to tell your role, that I'm a clinical pharmacist working over here, or I'm a community pharmacist. And also you have to ask the patient's name and their date of birth also, so that you can understand it is the same patient that is about which you have prepared, because of the names or surname you can just get confused, and that is why you have to cross check with the patients again. Okay. Also in this step, you are going to clarify the purpose of the consultation, ki why the patient is over here. That also you are going to clear in this step only. So here are some dialogues that I have put here. Like for example, I have put ki today here we are there to discuss on a medication called as metformin. Is that like, do you know about that, or is it correct? Then you can ask some basic question: do you know why metformin is given to you, or do you have any concerns about metformin? So what happens in this type of this step, what happens, first of all the patient becomes comfortable with you, they start opening up. Okay, so you have to use open ended question, don't ask very specific questions. Try to ask broad ended questions so that the patient will give you more information also. And then what will happen with these certain questions also, you can understand ki is any issue, particular issue that your patient is facing. So that what will happen, then you will not waste any time in counseling on other unnecessary things, and you will just take up the more focused points only. Okay. Now, in this same step, also, what you can do, you can also have a quick review of the patient's drug history, some allergy or contraindications. Like you will be having the patient's file with you, but then also some of the information may be new, only the patient is knowing. Some new medication they have started, some homeopathy, some Ayurvedic medication. So you just ask them, are you taking any other medications for this same disease? Are you facing any kidney issues or liver issues? Are you allergic to any medication? So in this second step only, ask certain information, some information that will help you to guide the further steps. Okay. So second step is there, that is introduction and opening of the session. Next is what, explanation related to the disease and medication. Now here we have taken the drug that is metformin, which is used for diabetes mellitus. Okay. Now in this first point, what we have told ki why why metformin is given to you, what use it is having, how it is going to bring down the blood sugar levels. Okay. Then also in the next point, what we have told about its mechanism, कि how mechanism is explained. But remember that कि the mechanism, or whenever you are talking to your patient, don't use any high end medical terminologies, because your patient is a layman, is a common man, is not going to understand any hi-fi medical terms. So you have to counsel in such a way, considering that the patient is going to understand the language of a fifth standard student, and then you are going to speak in such simple language. Okay. And even though all these points are going to be in English, remember that you have to counsel your patient in the regional language only. Like for example, in Maharashtra we use mostly Marathi, that is why the students have to counsel or tell these points in Marathi. If your patient is speaking Hindi, then you are going to use Hindi. So these all counseling should be in the regional language, or the language which is understood by your patient. So here we are trying to tell the patient ki why metformin is given, how metformin is going to bring down the blood sugar levels. Okay. In the next point, we are telling them ki why it is important for them to take metformin. It is not only going to bring down the blood sugar levels, but it is also going to manage or slow the progression of the disease. So there will be no complications also in the patient. When you are going to like give importance of this medication, ki how it is bringing down the sugar, how it is decreasing the complication, then the patient will understand ki why I have to take the drug regularly, and I don't have to stop it in between. Okay. Then you're going to tell about the dosage form, when they have to consume that, with food, without food, take it with water, do not take it with milk, do not take it with any aerated drinks. So how they have to take the drug. Okay. Then you are going to tell about ki metformin or diabetes treatment is lifelong. It is not like some kind of infection treatment ki take it for 15 days and then you will get better. So you have to tell them ki it is a lifelong treatment, and you will have to take the drug every day, lifelong. Do not stop the medications in between, and if needed we can change the dose of metformin also. So in this drug counseling, we are telling about why metformin is given, mechanism in easy terms, how it is with other, how it is going to manage other complications, what is the dosage form, how they have to consume. Okay. And then lastly, we are going to tell about the side effects to the patients also. Remember that whenever you're telling to the students, as like whenever you're teaching, remember that don't tell about all the side effects, because if you will go to any pharmacological or any therapeutics textbook, there is going to be a big list of side effects. But if you tell all the side effects to your patient is going to be under the fear, and then the patient will think, why should I take this drug if it is going to do me more harm than benefit? So you're going to tell the most common side effects, and that also in easy term. Like for example, metformin is going to cause what? Stomach upset. So tell the patient, if you have stomach upset, it is intolerable, you are having more episodes of stomach upset, just get back to me, and then we can do something about that. Okay, then about the missed dose also you have to be telling in this point, because most of the patients they think, what if I forget one tablet and then I will take two tablets together and then I'll feel like more better, my blood sugar level will come down. So that they don't have to do, otherwise their blood sugar will go down very quickly. And lastly, we have to tell them ki even though you are taking medications, you have to do other modifications also, like you have to pay attention to your diet, you have to pay attention to your physical activity, you have to do exercise also regularly, then your blood sugar levels are going to come down. Taking a medication is not going to solve all your problems. Okay, so in this drug and medication counseling, you are going to tell all these points to your patient. Okay, and then we are coming now to the last step, that is closing the session. We have seen three steps: opening the session, then explanation related to the disease and medication, and then is closing the session. Now in the closing the session, what you're going to do, you're going to summarize some of the important points. Once again you will repeat, because the patient is just going to be listening, maybe they will be listening half of the things, they will forget half of the things. So what you will do, you will repeat the some of the key points. See, you will tell, ha, metformin is there, this medication is going to bring down your blood sugar levels, you're going to take it at this time of the day. So some important points that you can tell to your patient. Also you're going to ask the patient if they're having any questions, so that you can once again clear that questions by explaining them. Also in between of this all the steps, what you can do, and again you just ask the patient ki whether they are understanding properly or no, like they want any specific information, so cross check in between ki whether they are able to understand or no. It should not be one sided dialogue, just you are speaking and they are going to listen. Also remember, now your patient is a common man. When you're going to provide so much so much medical information to the patient will not be able to collect that at once. So what you can do, you can ask your students to make PILs, patient information leaflets, on the common diseases that you're seeing in the hospital or the cases. Like we are having too many diabetes patient, hypertension patients are there, hyperlipidemia patients are there. Okay, so this patient information leaflet, like this exercise you can do, in that they can put all the information in simple language and give this leaflet to the patient. Whenever they will have some time or whenever they are having any doubt, they can just go through the leaflets. Okay, or also what you can do, instead of providing written information, you can give them some visuals, like while explaining only, you can use some videos, some pictograms, with which the information can be effectively understood by your patient. Because just providing theory information will become too boring for the patients. Okay, now coming to the last point, that is, while taking this patient counseling activities, what you can do, you can divide the students into certain groups. Okay, and then what you can do, you can make one of the student to be a patient and other to be a pharmacist. So this is nothing but role play exercises. So what can happen, the patient, if the person is going to be a patient, they will start understanding how the patient feels, or how, what are the needs of the patients. Okay, and when the student is going to be a pharmacist, he will understand ki what all preparation they are going to be needing to provide the counseling session to each of the student, or to each of the patient. So when they're going to play the other part of the role, they will be able to start understanding what are their needs, how they have to prepare, how the patient is going to be dialoguing with them. And it will become more fun activity only. Just teaching patient counseling through theory is going to be very difficult, because patient counseling is all about practice. So practice and practice. There is no any particular way, there is no any SOP for patient counseling. Every patient is going to be a new patient, their needs are different, their diseases are different, drugs are different, so you every time we have to prepare freshly. So through this role play exercises, it can be very effectively be carried out, and like you can provide one demo to the patient, like to the students, ki these are the dialogues through which you can converse, and then they can do the like exercise on their own also. in front of you. And for this pharmacotherapeutics, I have put some of the resources which are going to be really helpful for you all to like to refer to the theory, take up different case studies for the patient, like for the students to solve. These all books are having ready-made cases. Some of them are also having solutions to that also. So you can take a small easy case from this and give the scenario to your student ki this patient is having this complaint, and you can just counsel the patient right now. Okay. Also, then we are having certain drug databases from which you will get up to date drug information, and which is all evidence based. Okay, it is all authentic information like micromedics is there, lexicom is there. Then we are having certain free drug databases also. Medscape is there, hippocrates is there. And also lastly, we are having some clinical guidelines also, standard treatment guidelines, which is going to tell you ki how you are going to select a drug for the patient. And as diploma students are having like basic cardiovascular endocrinological diseases, so they can have standard treatment guidelines, 4 to 5 standard treatment guidelines for all of the diseases. So they have to know ki what is the best choice of drug for the patient. And that also all the up to date choices of drugs are there, what doses are there, what are the side effects. Maybe 10 years back for hypertension we were starting with beta blockers, calcium channel blockers, but right now the JNCAD guideline says that start with ACE inhibitors or ARBs. Beta blockers now has gone to a second choice. So these all information they are going to understand from the standard treatment guidelines. So these books and drug databases are going to be really helpful for you to take up cases. Then theory wise also you will get lot of information, and the standard treatment guidelines also. So I hope these resources are going to be very helpful to you also. And if you're having any queries regarding soap writing, or you want cases, or how they have to do the counseling, you can just write on this mail ID also. This is my mail ID.
Thank you, ma'am, for such an informative session. Thank you, ma'am, for such an informative session. Our viewers want to ask some question. Can we start with the question and answer session, ma'am?
Yes, yes, sure, ma'am, sure.
Okay. Shilpa Shinde, ma'am, want to ask you. Please suggest website or any other online platform where we can get reference for such SOPs.
Soap note, like if you want a standard format, like these books which I have told you, resources, the books are there. In this soap writing is already given the first chapters. So there you will write ki how you will get soap note also, and in the further chapters you will get ready-made cases also, small cases.
Another question from Akshay Khade. Where we can find cases of SOAP while we have to take practicals.
Practicals, like there is one book that is called like Koda Kimball is there, that is the author's name. In the resources only, whatever the three books are there, no, in that three books also the cases are being given. All good quality cases are there, and online also we'll get a variety of cases.
One more question, ma'am. As a pharmacist, what should we counsel for drug or for disease?
You have to counsel more about the drugs only, because the disease you have to tell, like for example 100%, in that 5% you tell about the disease, and 95% about the drugs, why the drug is given, how they have to take the drugs, what is the dosage form. So more you have to focus on drugs, because the patients wants to know about the drugs only.
Thank you, ma'am. Krish Satya Krishna want to ask you, can we expect a pharmacist with diploma in pharmacy qualification in India to prepare SOAP notes?
I know it is little like hard for them, or like it is very difficult because the student had just passed out 12 standard, but like not very in detail the soap note, but we can at least clear the basics of soap note, like not very in detail, but at least understanding the patient's basic problems and providing solutions. At least that the students, if diploma students can do that much, then the half of the physician's work can be solved. And at the initial level, it is going to be little difficult for the students and the faculty, but with practice, I am very sure that they will be able to do that.
Uh, Last question, ma'am. Dr. Harshvardhan Misal sir want to ask you, in this crowded medicine market, do pharmacists or shop owners have that much free time to spend on one particular patient?
Obviously, the pharmacists and physicians are like not very free to provide the counseling sessions, right? But when you are going to be dispensing, you can ask the patients for ki whether they are interested. Ask their interest ki whether they want to attend this counseling session, and initially give it free of cost. And then
Okay.
you can ask the patient to take an appointment, come visit their pharmacy, and then you can plan for a half an hour session with them. During dispensing, it is very hard for them. They have to take a different appointment, come down to you, and only you can start with some interested patient. Then once they understand ki, some of the patients are getting the benefit, they will also come back to you.
Okay, thank you, ma'am. I hope all the participants have got their answers of question. Now, I sincerely thanks to Dr. Shraddha Devarshi for giving us her valuable time and gracing this session by her presence. Thank you once again, ma'am. This EEFDP program is organized in association with APTI Maharashtra, and I sincerely thanks APTI Maharashtra for their constant support. The next session will be start at
There,
1:30.
there, there is one notice for all the participants. We have shared the feedback link for yesterday in the YouTube chat box only. And again, the link for the second session or second day will also be shared in the YouTube chat box only. So all are requested to attend the session and then fill the feedback form. The time for the second session will be communicated shortly to you. We are planning to prepone the session. We'll try to cover it as planned or as early as possible. We'll communicate it with you. Right. Thank you so much. Thank you, ma'am, for your session. Thank you.
Yeah, thank you, sir and madam, like for this opportunity which I have got for delivering the session, and I hope I've done justice to the topic also. And like one
Absolutely.
suggestion, like for the case studies, like I've remembered that if you can gather the case studies from the hospital, if the like the college is associated with some hospital, you can get some cases from there or prescription from the pharmacy directly, some case
Okay.
studies. So they are all going to be live cases, so it will become very easy for the students also.
Okay.
So thank you, sir and madam, for this great opportunity, and METS Institute of Pharmacy also for inviting me. Thank you, sir.
By just a minute, ma'am. By participants' perspective, what we'll
Yes,
be doing is, we feel that there may be some other questions rather than what were asked in the live session.
yes,
Participants
yes,
may have some questions. So what we'll do is, we are trying to collect all those questions from the participants,
yes,
filter
yes,
those out, and then get it solved from your end. So
yes, yes, sure.
I will be requiring your help in solving the doubts for our participants also.
Yes, yes, sure, 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 sir. I know
Okay.
with one of the session it is like very hard for delivering or telling ki just this is soap and you start taking the practicals. But
True.
with time it is going to be very easy, and discussion and practice, that is the way ahead. And I'll be very happy to solve the questions coming from the
Thank you so much,
participants. Yeah,
ma'am. Thank you.
yeah.